Anti-aging, healthy
Healthy
aging.
aging, yeah. But speaking of longevity and healthy aging, one of the systems in our body that ages the fast, and that's our reproductive system. It
Hmm.
doesn't matter how much of protandium you take. It doesn't matter how much of GLP you take. Unfortunately, physiology is physiology.
Yeah.
You and I, every woman comes to this world with certain amount of eggs in this world, and we have them in the form of primordial follicles. So as we start menstruating and ovulating, we take that follicle and we, you know, mature it, and then we ovulate. We take the follicle, we mature it, and we ovulate. So every time when we ovulate, that egg is gone. So we don't make eggs. We have what we have. So if we
Hmm.
start doing that from the age of 14, and now it's getting younger, to age of 12, by the age of 35, majority of us deplete that reserve that we have, ovarian reserve, unfortunately.
Hmm.
So that's the physiology. And that is my battle today with humanity, with women in developed countries, which this is my patient population, trying to explain that socially we put our reproductive function on the back burner. You and I, we had to go through immigration, we had to go through medical schools, we had to go through so many things, build a career, you had to go through residency. So, and then you start thinking about getting pregnant, right? And that's became a norm. But fortunately, I come from the country where even if you were in medical school, you get pregnant. If you're 20, 25, if you're 25, you're already old. You have to get pregnant. And you know what? At the time, I thought, oh my God, this is so not, it's not conventional. I mean, it's conventional, but it's not cool because today is a modern day. I'm a modern woman. That's what I thought. But then like I said, when I got pregnant, looking back and dealing with patients today and, for the past, almost 30 years, I realized that that is the way. So number one is physiology. We must remember that we have specific amount and nobody knows. Looking at the girl, looking
How
at the
much?
patient in day 20, I can't tell you how long your reproductive will last. It depends on your genetics. It depends on your lifestyle. It depends how many eggs you brought to this world. You see?
Yeah.
So that is the dilemma of today's society, unfortunately, women's place. And this is something that we have to educate patients a lot. But then, and the reason why I started really promoting and talking about this, educating this, is because once upon a time, I had a patient in her late 30s, 38, 35, who was trying to get pregnant, couldn't get pregnant. She comes to me, I do her blood test. She depleted her ovarian reserve. She had no eggs left. And the only option for her was donor egg. And I remember her sitting and crying in my office saying, how come nobody told me this when I explained the physiology? If I knew that at that time, I would take measures. So that triggered me to start talking and educating patients about reproduction,
Hmm.
women about their reproduction. And yes, a lot of women actually realize, listen, and then next thing you know, they come back pregnant. My office always laughs. Every time when they leave after the annual exam, 2 months later, they come back pregnant because I tell them, come back pregnant. It's time. But some of them just don't realize and don't hear me, unfortunately. And sometimes they leave my office crying, thinking that it's too harsh, but it's true. Unfortunately, it's true. That's how we build.
Yeah.
So
Yeah.
that's my thing about reproduction. Now, there are ways to rejuvenate or support your reproduction. Let's say the girl cannot have a baby right now. She's 27. She's planning to do it at 32. There are ways to keep it healthy and young, right? What would you
Yeah.
recommend?
Well, first of all, I see that so many people have micronutrient deficiencies, right? So having these, it's definitely an impediment, definitely. Then
Absolutely.
hormonal. Again, we're going back to metabolic syndrome and PCOS, polycystic ovarian disease. So many women have that, and again, the more inflammation you have in your body, the more problems you have with everything. and the more hormonal abnormalities. And if they started, taking birth control pills, maybe, earlier on, that can also interfere. And when you fix the thyroid function, the adrenals, when you balance the gut health, when you decrease inflammation in the body and help all these organs work really well, then absolutely your ovaries are going to work much better. But I love the Dutch test, right, that we do in functional medicine, because it tells you the dynamic metabolism of hormones. It's not just one level at one point in time. You see exactly where everything is coming from and where they're going, because you can have a sink, right, that is full with water, but you don't know, is it because the faucet was, leaking all the time, or because the drain is clogged? The same thing with our hormones. And estrogen, again, can be different types of estrogen. How are they metabolized? All of these data that we find out from that test can help a lot. And especially if, women have family history of malignancy, breast cancer, ovarian cancer, or uterine cancer, that can help a lot to, I think, hopefully prevent this from happening. But definitely, we have to think of the reproductive system as a comprehensive hormonal milieu. And if everything works well, and if all the inflammation and the right micronutrients is controlled and the right micronutrients are given, then you definitely increase your chance. And of course, manage stress and exercise routinely, but not, again, high level, like strenuous exercise, because that can inflame you. There are all these, women that go to the gym and lift heavy weights, deadlift 200 pounds, and then they run for an hour, and they're like, and then they wonder that they're inflamed and nothing's happening. Well, everything in moderation sounds much better to me.
That is so
Right?
true. That is so true. And I do get patients who are trying to get pregnant and for us quite some time, and the doctors call it unexplained infertility. So basically, the same diagnosis that I had with idiopathic angioedema, it's basically the same thing, unexplained. And they saying that unexplained infertility is on the rise right now, statistically. But to me, it's actually pretty much explained. I know the explanation. I think I know the explanation. If you really look, like you said, a Dutch test, if you look at the hormones, if you look at the cortisol, if you look at the nutritional deficiencies, if you look all the together, think about us as a mammals, right? And again, go back to our evolution when we used to live in caves. The reason why we're here is because we evolved, and those who did not evolve and adapt, they perished. So genetics that we have today is the evolved genetic to survive. So we had to survive. And how did we survive? During wintertime, we didn't have nutrition. So we were malnourished. Okay. And during that time, we were not supposed to ovulate to conserve the energy. Because if I would get pregnant at the time, I would die. It's a survival mechanism. Plus, if also I'm living in the caves and I'm surrounded by tigers, I won't be able to run away from tiger. I have to preserve myself, so I cannot ovulate at this moment. All the animals live the same, this principle in any mammal animal, including humans. Okay. So today we don't have tigers. We don't have winters, long winters when we don't eat, but we do have nutritional deficiencies due to many other factors. So your body is in nutritional deprivation. Nutritional deprivation. Your body is thinking that you're surrounded by tigers because you're constantly under stress, emotional stress, physical stress, like you said, lifting weights and doing certain things that maybe at that moment not recommended for you. So your body thinks, no, I can't. So you check that patient's blood work. Her ovarian reserve is perfect. His sperm is perfect. They can get pregnant. And they recommended to go for ovarian stimulation, for IUI, for IVF. And all you have to do, feed the body, calm down, bring the cortisol down, and miraculously they're pregnant.
Yeah.
I had a patient who came in recently, goes, Vitamin D, that's all I needed? Yeah, that's all you needed.
Yeah, I had a patient like this with, I think she had 3 or 4 vitamin deficiencies and some mineral deficiencies, and literally was trying for like 5 years to get pregnant. Within 4 months, she got pregnant. She was like, really?
Really? Exactly.
Really? Amazing, amazing, amazing. But it's cellular deficiencies. That's the other thing. We're doing cellular micronutrient testing, not just blood levels of,
Yeah, cellular
vitamins that you
testing and
can,
then cellular nourishment
right.
afterwards. That's all. Because,
Yep.
like you said, the body knows how to fix itself. And all you have to
Yeah.
do, push the right buttons, which
Yeah.
is your
Pretty
G.
smart.